and then the one on my left, I think it's a T1 with contrast.
Yes.
Noted at okay, L4, L5 intervertebral disc space. So the disc there is it shows abnormal enhancement of the disc. Also noted is the vertebral body, the superior part of the vertebral body also shows some abnormal enhancement. So the L4, both vertebral bodies show abnormal enhancement as well as the intervening disc. Then looking at the T2 image, first I can see a hyper intense fluid collection anterior to the vertebral bodies, which is likely an abscess. And there's also is it the same patient or they are two
different patients?
Two different patients. Okay, all right. Okay, so then I would start with. So in this image, we can see the vertebral body at let me start counting. So this is a C-spine, yeah, and this is a lumbar spine, yeah.
Yes.
Yes.
Thank you.
Yeah. So 2, 3, 4, 5. So C5, the vertebral body height is reduced significantly, and then C6, there's what appears to be a vertebral planner with an abscess noted spanning from C5 to C6. So with these findings, I'll make an impression. So for this one, I'll make an impression of a pyogenic abscess, because the disc is pyogenic spondylodiscitis, because the disc is mainly involved. The cervical one, I'll make an impression of because the vertebral bodies are involved and the disc are mildly involved, and with the abscess, I'll make an impression of TB, spondylodiscitis.
Okay, so this is classic, right? Yeah, let me put the pointer. So this is classic finding you see, right? Bone marrow edema, disc abnormal signal, and on this is contrast, right? So there's enhancement and there's a pre-vertebral fluid, and maybe there's a post is hard to tell, right? Due to the axial. So this is typical discardis osteomyelitis. You see the end plate irregularity here, there's end plate destruction. This is in the C spine. I think this was the fusion congenital, but there was a, as you said, there's a lot of fluid and the abnormal signal, right? And it's going in the front part of the vertebral body, but here is a disc signal, right? So this is typical discardis osteomyelitis you see, right? And most likely these are pyogenic. So keep this in mind, right? That this is classic finding we get, and sometimes we get this, and this is the bony destruction after we are doing the process for later on. And sometimes we just see the little hint of here that there is something protruding out there, and then you do MRI to see there's the epidural abscess or not. Right? Sometimes we see this on the CT, bony destruction. And next case, somebody wants to take this. Iram, right?
Yes. Hold on. So these are the two MRI.
So this one is, there's a fluid, right? So it's T2. And this one is T1. See, in the spine, there is no much, T1 or T2. We don't have much of stage start, but usually we do axials T1 and T2, right? And T1 post contrast. So this is T1 post contrast.
Hello. Hello. Areas of high signal intensity within um, high signal intensity. Post contrast. I see with just some areas of high signal intensity as well. T1 and the T2. So with these findings of abnormal signal intensity, likely fluid collection